Liver cancer is one of the most challenging cancers to catch early. The reason is simple but concerning. The liver is remarkably resilient and can continue functioning even when seriously compromised. In fact, most people with early-stage liver cancer experience no symptoms whatsoever. The disease silently develops, often for months, before any warning signs appear. This presents a critical problem. By the time symptoms do become noticeable, the cancer is frequently in an advanced stage when treatment options become more limited. But here's what people need to understand. There are subtle early symptoms that can appear, and recognizing them could make the difference between catching liver cancer when it's most treatable and discovering it too late. So let's talk about the 7 early symptoms of liver cancer that often go completely unnoticed or are dismissed as something else. This information is presented in a clear, straightforward way, focusing on what people need to know to protect their liver health and catch potential problems early. Understanding liver cancer and why it's so silent first, it's important to understand what liver cancer is and why it's so difficult to detect in its early stages. The most common type of liver cancer is called hepatocellular carcinoma, which accounts for about 85 to 90% of all primary liver cancers. Primary means the cancer starts in the liver itself, as opposed to spreading there from another organ. This type of cancer typically develops in people who already have chronic liver disease or cirrhosis, conditions that cause long-term damage and scarring to the liver. The liver is the largest internal organ in the body, weighing about 3 pounds and sitting in the upper right portion of the abdomen, just below the rib cage. It performs over 500 essential functions, including filtering blood, producing bile for digestion, storing nutrients, and breaking down toxins. Because the liver has such remarkable regenerative abilities and such extensive functional reserve, it can continue performing its duties even when a significant portion is damaged or compromised by cancer. This resilience is normally an advantage, but it becomes a disadvantage when it comes to cancer detection. The liver doesn't send out distress signals until the disease has progressed substantially. Additionally, many people who develop liver cancer already have underlying liver disease, so they're accustomed to feeling somewhat unwell. New symptoms get attributed to their existing condition rather than recognized as warning signs of cancer. Symptom number 1: unexplained weight loss and loss of appetite. The first early symptom that often goes unnoticed is unexplained weight loss combined with a decreased appetite or early satiety, feeling full after eating only small amounts of food. Weight loss is one of the most common symptoms that eventually brings people with liver cancer to medical attention, but it's often dismissed in the early stages. Someone might notice they're losing a few pounds here and there without trying, but they attribute it to stress, being busy, or getting older. They might think it's actually a good thing if they've been wanting to lose weight, but cancer-related weight loss has distinct characteristics. It's unintentional. The person isn't dieting or exercising more. It's persistent. The weight keeps coming off week after week, and it's often accompanied by changes in appetite and eating patterns. People with developing liver cancer often notice they simply don't feel hungry. Food that used to appeal to them no longer does. They might sit down to a meal and feel full after just a few bites, a phenomenon called early satiety. This happens because as a liver tumor grows, it can press on the stomach or other nearby organs, creating a sensation of fullness. Additionally, the cancer changes the body's metabolism and can trigger the release of substances that suppress appetite. The weight loss from liver cancer isn't just from eating less. The cancer itself changes how the body uses energy, causing it to burn calories at an accelerated rate. The person might be eating what seems like adequate food, but still losing weight because the cancer is consuming resources. Medical guidelines suggest that unintentional weight loss of more than 5% of total body weight over 6 months is significant and warrants medical investigation. For someone weighing 160 pounds, that's a loss of 8 pounds without any deliberate effort to lose weight. Symptom number 2: persistent fatigue that rest doesn't relieve. The second symptom is profound: unrelenting fatigue that doesn't improve with rest or sleep. Fatigue is one of the most commonly reported symptoms across all types of cancer, and liver cancer is no exception. But the fatigue from liver cancer has a specific quality that distinguishes it from normal tiredness. This isn't the kind of tiredness someone feels after a long day at work or a poor night's sleep. This is exhaustion that's present all the time, that makes even simple activities feel overwhelming. Someone with this symptom might find themselves needing to rest after showering, or feeling too tired to prepare meals, or having to take multiple naps throughout the day just to function. The fatigue occurs for several reasons. When the liver is compromised by cancer, it can't efficiently remove toxins from the blood. These accumulating toxins make the person feel sick and exhausted. Additionally, liver cancer can cause anemia, a shortage of red blood cells, which reduces oxygen delivery throughout the body and causes severe fatigue. The cancer itself also triggers inflammation throughout the body, and this inflammatory state is inherently exhausting. What makes this symptom easy to miss is that many people with underlying liver disease already experience fatigue as part of their condition. A person with hepatitis or cirrhosis might be accustomed to feeling tired. When the fatigue worsens due to developing cancer, they assume it's just their liver disease progressing or that they're having a particularly bad stretch. They don't recognize it as a new and concerning symptom. Symptom number 3, vague upper abdominal discomfort. The third symptom is discomfort, fullness, or a dull ache in the upper right portion of the abdomen, just below the ribs. This symptom is particularly insidious because it's so vague and easy to dismiss. It's not sharp, severe pain that would send someone rushing to the emergency room. Instead, it's a nagging sensation of fullness, pressure, or mild aching in the area where the liver sits. People with this symptom often describe it as feeling like something is pressing outward from the inside, or like there's a weight or heaviness under their ribs on the right side. The discomfort might be constant, or it might come and go. It typically doesn't respond well to antacids or typical remedies for stomach upset. This discomfort happens because as a liver tumor grows, it stretches the liver's capsule, a thin, sensitive membrane that surrounds the organ. The liver itself doesn't have pain receptors, but the capsule does. As the tumor expands and the liver enlarges, the capsule stretches, creating that sensation of pressure and discomfort. Sometimes this discomfort can even be felt in unusual locations. Some people with liver cancer experience pain in their right shoulder or their upper back between the shoulder blades. This is called referred pain. It happens because the nerves that sense pain in the liver capsule also connect to nerves in the shoulder area. The brain interprets the signal as coming from the shoulder when it's actually originating from the liver. Many people dismiss this symptom as indigestion, gas, or muscle strain. They might take over-the-counter pain relievers or antacids, which provide temporary relief or no relief at all. But discomfort in the upper right abdomen that persists for more than a few weeks should always be evaluated by a doctor. Symptom number 4, generalized itching without rash. The fourth symptom is persistent, generalized itching of the skin without any visible rash or obvious cause. This is one of the most overlooked symptoms of liver cancer because it seems so unrelated to the liver. Someone experiencing this symptom might try moisturizers, change their laundry detergent, or assume they're having an allergic reaction to something. They rarely connect itching skin to a problem with their liver. But the connection is direct and significant. When the liver isn't functioning properly due to cancer, it can't effectively process and eliminate a substance called bilirubin. Bilirubin is a yellow pigment produced when red blood cells break down. Normally, the liver processes bilirubin and excretes it through bile. When this process is disrupted, bilirubin accumulates in the bloodstream and eventually reaches the skin, where it causes intense itching. The itching from liver problems has distinct characteristics. It's typically generalized, affecting large areas of the body rather than just one spot. It's often worse at night, sometimes severe enough to disrupt sleep. It doesn't respond to typical anti-itch creams or antihistamines. And critically, there's usually no visible rash, bumps, or skin changes, just relentless itching. Research indicates that itching occurs when excess bilirubin and bile salts deposit in the skin tissues, irritating nerve endings. The symptom can appear even before other obvious signs of liver dysfunction become apparent, making it a potentially early warning sign. People with this symptom often scratch their skin raw before seeking medical attention. They might have tried every over-the-counter remedy without success. If someone experiences persistent itching without any apparent cause, especially if it's worse at night and affects multiple body areas, liver function should be evaluated. Symptom number 5, subtle yellowing of the eyes. The fifth symptom is jaundice, yellowing of the skin, and particularly the whites of the eyes. Though in early stages, this can be extremely subtle and easy to miss. Jaundice is caused by the same bilirubin buildup that causes itching. As bilirubin accumulates in the bloodstream, it eventually causes visible yellowing of tissues. The whites of the eyes typically show yellowing before the skin does, and this is often the first place people or their family members notice the change. In the very early stages, the yellowing can be so mild that it's barely perceptible, especially in certain lighting. Someone might look in the mirror and think their eyes look slightly different but dismiss it as lighting or fatigue. Family members who see the person every day might not notice the gradual change. Jaundice in liver cancer can develop for several reasons. A tumor growing in the liver can block bile ducts, the tubes that carry bile from the liver to the intestines. This blockage causes bile and bilirubin to back up into the bloodstream. Alternatively, if the cancer has damaged significant portions of the liver, the organ simply can't process bilirubin efficiently anymore. The yellowing typically appears first in the eyes, then in the face, and eventually may spread to the chest and other body areas. It's often accompanied by other symptoms: dark-colored urine that looks like tea or cola, and pale, clay-colored stools. These color changes occur because bilirubin that would normally color the stool is instead being retained in the blood, while excess bilirubin is being excreted through urine. People with darker skin tones might have more difficulty detecting yellowing of the skin, making examination of the eye whites even more important. Anyone who notices even subtle yellowing of their eyes, especially if accompanied by dark urine or pale stools, should seek medical evaluation promptly. Symptom number 6, feeling full or bloated in the abdomen. The sixth symptom is a sense of abdominal fullness or bloating, sometimes accompanied by visible swelling of the belly. This symptom develops when liver cancer causes fluid to accumulate in the abdominal cavity, a condition called ascites. It can also occur simply from the liver enlarging due to tumor growth. When someone develops ascites, they might first notice their pants or belt feeling tighter around the waist. Their abdomen might look distended or swollen. They might feel uncomfortably full, as if they've eaten a large meal even when they haven't. The swelling is typically most noticeable in the lower abdomen. Ascites develops through several mechanisms. Liver cancer can increase pressure in the blood vessels that run through the liver, causing fluid to be forced out of these vessels and into the abdominal cavity. Additionally, a damaged liver doesn't produce adequate amounts of albumin, a protein that helps keep fluid in blood vessels. When albumin levels drop, fluid leaks out into surrounding spaces. People experiencing this symptom might also notice swelling in their ankles and legs, especially at the end of the day. This happens because the same mechanisms causing abdominal fluid buildup can cause fluid retention throughout the body. This symptom is often mistaken for weight gain, gas, or digestive issues. Someone might attribute it to eating certain foods or not exercising enough. But abdominal swelling that develops relatively quickly over days or weeks, especially when accompanied by other symptoms on this list, is not normal bloating and requires medical evaluation. Symptom number 7, mild fever and generalized feeling of unwellness. The seventh symptom is a persistent low-grade fever, often accompanied by what doctors call malaise, a general feeling of being unwell, of not feeling like oneself. This is perhaps the vaguest of all the symptoms, which is exactly why it's so often overlooked. Someone experiencing this might tell others they just feel off or not quite right, but can't pinpoint exactly what's wrong. They might have a slightly elevated temperature, nothing dramatic, maybe 99 or 100 degrees instead of their normal 98.6. This fever and malaise occur because cancer triggers an immune response. The body recognizes cancer cells as abnormal and mounts a response against them, which includes the release of inflammatory chemicals called cytokines. These cytokines can cause fever and that general sick feeling. Additionally, as liver cancer progresses, cancer cells can die and break down, releasing substances into the bloodstream that trigger fever. Some liver tumors also produce hormones or other substances that affect body temperature regulation. People with this symptom often think they're coming down with a virus or fighting off an infection. They might rest for a few days expecting to feel better, but the vague unwellness persists. The fever might come and go, perhaps being higher in the evening and normal by morning, which adds to the confusion. When this symptom occurs alongside any of the other symptoms discussed, weight loss, fatigue, abdominal discomfort, itching, or jaundice, it becomes much more significant and warrants immediate medical investigation. The importance of risk factor awareness. Certain people are at significantly higher risk for liver cancer and should be especially vigilant about these symptoms. High-risk groups include people with chronic hepatitis B or C infection, those with cirrhosis from any cause, people with non-alcoholic fatty liver disease, those with a history of heavy alcohol use, and individuals with certain genetic conditions affecting the liver. If someone falls into a high-risk category and experiences any combination of these 7 symptoms, medical evaluation should be sought promptly. High-risk individuals should also be receiving regular screening for liver cancer, typically with ultrasound and blood tests every 6 months. What to do if these symptoms are present? If someone recognizes these symptoms in themselves, the appropriate course of action is to schedule an appointment with a doctor and provide detailed information about all symptoms being experienced. It's important to mention any risk factors for liver disease: prior hepatitis infection, history of alcohol use, family history of liver problems, or known fatty liver disease. People should describe exactly what they're feeling, how long symptoms have been present, whether symptoms are getting better or worse, and how symptoms are affecting daily life. Doctors have several tools to evaluate for liver cancer. Blood tests can check liver function and look for elevated levels of alpha-fetoprotein, a substance that's often elevated when liver cancer is present. Imaging tests including ultrasound, CT scans, and MRI can visualize the liver and detect tumors. If abnormalities are found, a liver biopsy might be performed to definitively diagnose cancer. The key message is this: any persistent symptom or combination of symptoms warrants evaluation, especially in someone with risk factors for liver disease. Early detection of liver cancer dramatically improves outcomes, with 5-year survival rates reaching 37% for localized disease compared to just 3% once cancer has spread throughout the body. Liver cancer often develops silently, but it's not always completely symptom-free. The 7 early symptoms that frequently go unnoticed include unexplained weight loss with decreased appetite, persistent fatigue that doesn't improve with rest, vague discomfort in the upper right abdomen, generalized itching without rash, subtle yellowing of the eyes, abdominal fullness or bloating, and low-grade fever with general malaise. These symptoms are easy to dismiss because they're vague, nonspecific, and can be attributed to many other conditions. But when they occur in combination, when they persist beyond a few weeks, or when they occur in someone with risk factors for liver disease, they deserve medical attention. The liver's remarkable ability to function despite significant damage is both a blessing and a curse. It allows the organ to compensate for injury, but it also means cancer can grow undetected. By being aware of these subtle early warning signs and taking them seriously, people give themselves the best chance of catching liver cancer when treatment is most likely to be successful.